correspondence from the Nanaimo Community Advisory Board, request for additional access to showers and laundry in Nanaimo. And we do have a delegation, Vicky Trill, Deborah Hollins, and Guy Bolio.
I'm Vicky Trill from United Way, BC. So Reaching Home, you may or may not know, is a federal government program, and we are the CE for that program. The Reaching Home program is Canada's homelessness strategy. So it's a community-based program aimed at preventing and reducing homelessness. And this year, last year, and a number of previous years, we've put more than $1.7 million into Nanaimo in this cause. And last month, we heard a report at the Community Advisory Board meeting from Dr. Sandra Allison, who reported in tears about what they were seeing from their personal care outreach team. They saw an extreme increase in head and body lice, and to such an extent that these people were coming into the emergency room and having some pretty severe complications. So some of the solutions that have been discussed through the Community Advisory Board and were recommended through Island Health is, well, body lice. We need showers and clean clothes. And we have some showers, and we believe that with some more showers and an expanded shower program, that will really be one thing that will help. Head lice needs wet combing and or medicated agents. Something Island Health has been working to secure is our NICs, which is a very expensive solution, however, fairly effective along with wet combing. We're asking, how can we together work on this solution? Wondering if the city would consider coordinating a plan to fix the lice solution in collaboration with SPO, United Way, and other frontline service providers, as well as Island Health, as well as expanding the shower program and laundry services.
Thank you. Councillor Eastmere.
Thank you. Through you, my question is about what additional shower access would look like. So we do have the shower program at Caledonia Park, but would you say that there's a need to have access to showers in other parts of the city, not just that area?
Yes, I would. So I would think that the shower hours need to be increased, as well as the service needs to be at least for another 3 months, so that this problem can actually be tackled with the head and body lice. But it's been pointed out that both the Woodgrove area and what is the other, is it Norwood area, where there's a real gap where people might not be able to make their way to where the current shower program is.
Mr. Lindsay, I wonder if you could comment on what the city has done in the past.
Well, I think it's been mentioned, Your Worship, this evening, but since 2018, the city's provided both the space at Caledonia and operating funds, so for the last 5 years. So that's provided service for 5 hours a day, Monday till Friday. More recently, I understand the Unitarian unionized, and because of the increases in the budget, they approached us and ultimately said they had to pull back on the hours. They went from 5 to 3. But I believe, just listening tonight, I believe that maybe the money that was referred to that's coming from Unitarian through the cab was to make up the difference. So it's continuing to operate at 5 hours a day, as it has been since it opened in 2018. Staff were asked about expanding the hours, and it's a operational issue down there now. We have commitments with other groups that use that area, so the feeling was that we could not expand it for more than what's currently allotted.
And what other groups are using?
Mr. Harding, I don't know if he's still there, if he's going to jump in, but the VI Raiders use it as their practice field.
Amongst others. All right. Councillor Hemmons and then Councillor Armstrong.
Thank you, Your Worship. I'm going to support the motion.
But I probably will support the motion because I am curious to see if there is anything in the north end where we know we've seen a huge increase in homeless population.
I'm going to support the motion.
That I just wanted to mention that. So I will be supporting this as well. Thank you so much.
Thank you. Councillor Thorpe.
Thank you, Your Worship. Like several other councillors, I'm inclined to support the motion, but I certainly have some hesitation.
Thank you. I'm inclined to agree with Councillor Thorpe tonight in his comments. This is clearly and simply and most directly a public health issue. If the city hadn't been supporting this program as it has in the past, I would probably actually vote against this tonight. We have an entity supported through United Way, basically, asking us to provide monies when they, at the same time, received 1.7 million, I believe was the figure indicated tonight earlier, from the federal government to address issues. We have Island Health with a budget of hundreds and hundreds of millions of dollars annually that seems unable to address what is clearly a public health issue. I would assume Dr. Allison, the public health officer for the area, is aware of this issue. I note there is no support or comment from her on this. As Councillor Hemmons wisely pointed out tonight, we haven't received any comment or intervention or request from Island Health as well. So I look forward to the report, but I want to make it clear I absolutely am reserving my right, which is nothing unnatural, to vote against this proposal if it comes back and says that we can afford to do this, so to speak. We can afford to do anything, I suppose, if we wish to, but filling the role of the province, and Island Health in particular, and to some extent the federal government, we're accepting downloading in an indirect way at a request from an entity, so to speak, or a group that is funded by the federal government to help fulfill a provincial mandate. If there was ever an example of the kind of offloading and downloading, this would certainly be it. And I well appreciate the human sympathy around the issue of head lice, etc. I get that. But we have two real orders of government in this country and a third, and we're a creation of statute. Our job is not to keep trying to fill the gaps between governments that haven't accepted their responsibility and yet have access, as Councillor Armstrong always reminds us, to 92% of the taxation revenue in this country, when we have, as municipal governments, 8%. So I'm going to support it tonight, and I look forward to the report, but I am very conscious of the indication that has been made by various members of council in the discussion tonight to staff around what that report should contain, particularly around sources of revenue, who's paying for what, because it appears to me in the face of it what simply happened here is the Unitarian shelter unionized. They can't quite afford to provide the same numbers of staff, and everyone is turning to the city to fill that gap. So I'm not overly pleased at that prospect. If I've inspired anyone else, now's your time. If not, I'm going to call for the vote.